And I'm Veronica Zacek.
And we did our presentation on AIDS.
AIDS starts with HIV. HIV stands for Human Immune Deficiency Virus. This is a virus that weakens the immune system by affecting the T cells. It presents flu-like symptoms, however, our bodies cannot fight off this virus, and once it affects all of our body's T cells, a person is known to have AIDS.
Okay, like Veronica said, HIV gives one flu-like symptom. So a lot of times people don't realize they have HIV, they just think it's a common cold. As you can see, some of the symptoms: fever, chill, joint pains, aches, rashes, tiredness. So it's like a common cold.
After these symptoms disappear, there will be no longer any symptoms for up to 10 years. At this time, the virus is still affecting the immune system, and the person doesn't even know it. They can still spread the virus at this time.
As one has HIV for a duration of time, the symptoms get worse. It's still like having a common cold, kind of, but it's just you have it for so long. You have a fever, a very extreme fever for a long duration, very bad diarrhea, swollen glands, extreme weight loss. So basically, common cold symptoms just get extreme as one has HIV for so long.
This is an image of where some of the symptoms can occur. In the mouth, you can get sores. On the skin, you can get a rash, and the lymph nodes can become swollen and enlarged.
Okay, so as we said before, HIV is an acquired disease. It can be spread through sexual contact with one another, infected needles, and also blood transfusion or organ donation. And also, if one has an STD, you're more susceptible to getting HIV.
Some common myths about HIV are that other body fluids such as feces, saliva, tears, sweat can spread HIV. This is false unless those fluids contain HIV-infected blood. You can only acquire AIDS if you come into contact with HIV-infected blood, semen, vaginal fluid, or rectal mucus. Another common misconception is that only gay and bisexuals can contract HIV or AIDS. This is also false. Anyone can contract HIV, regardless of race, gender, sexual orientation, or religion.
Okay, so here are some stats about HIV and AIDS in the United States. 1 in 6 Americans have HIV and they're unaware. Like we said, different people's immune systems are wired differently, so you could have HIV for weeks and not even know it, have no flu-like symptoms at all, when actually you do have HIV. 1 in 4 cases in the United States are found in the youth, ages 13 to 24. 1.1 million Americans currently have HIV, and approximately 636,000 Americans have died from AIDS.
Some global statistics: 33.4 million people are living right now with HIV or AIDS. Since the first case was reported in 1981, 25 million people have died from AIDS. 97% of HIV and AIDS are found in low and middle income countries. In some countries in Africa, 1 in 3 people have AIDS, and 75% of the AIDS are found in sub-Saharan Africa.
Okay, so as Veronica said, you first get HIV and it attacks your T cells. Once someone's T cells are completely gone and they can't be used, one does have AIDS. And AIDS is acquired immunodeficiency syndrome. Like I said before, you're not born with AIDS, but it's acquired. It's a disease that you contract through bodily fluids or in blood. And AIDS isn't really a disease, it's a syndrome because it's very complex. It has many different components that go into it.
The debate is on whether the money that is used on AIDS should be invested in educating for the prevention of AIDS, or should it be spent on treatment for the helping of the people that are infected with AIDS.
Okay, so I will be arguing that the money should go into education. As I said, many people are unaware that they have HIV, so getting tested is educating yourself on if you have HIV or not. therefore, many more people would be more subconscious if they knew they did have HIV to not contract sexual partners or family members, things like that. Education is more cost efficient. Like we said, AIDS is very prevalent in African countries that are poor. If you take one leader and you educate him or her on AIDS, he can speak to a lot more people about the consequences of getting AIDS rather than giving everyone a pill that would help HIV. And also, when you're educating people on AIDS, such HIV, it's very impactful when you tell them the consequences, because if you go into a country in Africa that's poor, I guarantee that everyone knows at least some person with AIDS, and they know how devastating it is to them and their family. So being educated on how to stop the spread of AIDS would have more people more likely to be conscious about what they're doing. So there are many different options on how to educate people on AIDS. As I said before, we can educate people to go get tested if they are sexually active, because being tested is being educated. In just general education in general, it's known that, especially for females, that if they go through primary school, it cuts their chance in half of getting AIDS, because they tend to have more self-respect and a bigger purpose. And also, to put sex education in schools, what you should do if you have HIV and how to prevent your partner from getting it. So here are just some ways HIV education has helped in countries. Research in Nigeria shows that even a small education program can touch many people and greatly reduce medical bills in the future. So educating people on how AIDS is spread can lessen people's chances of getting HIV/AIDS and also lessen future medical bills. New analysis from Global Campaign for Education suggests that if every child got a complete primary education, the economic impact of HIV could be cut by 700,000 cases a year. During the 1990s, the HIV infection rate fell for half of the educated women in Zimbabwe, but showed little effect for uneducated women. And finally, in Uganda, where the infection rate is decreased, the key to this was education campaigns. They educated their leaders, and their leaders went out and spoke to the public about AIDS, and they saw great results from it.
I'm arguing that money should be spent on treatment. The earlier that someone gets HIV antiviral treatment, it improves their life quality, it extends their life expectancy, and it could reduce the risk of transmission. Although HIV does cause AIDS to develop, it is possible to have HIV without getting AIDS, and this is only possible with the right treatment. Some of these treatments include emergency HIV pills. These are for when an individual believes that they have come into contact with the virus within the last 3 days. It's an antiviral medication. Its treatment is very demanding and it lasts for 4 weeks. It can cause unpleasant side effects such as diarrhea, nausea, and fatigue, but it also could stop the virus from affecting all of the T cells. Another option is an antiviral drug. This is a lifelong treatment once somebody is infected with the virus. It has also very not nice side effects such as nausea, diarrhea, fatigue, and it can also cause birth defects. One of the other ones is complementary or alternative medicines such as herbal medications. These haven't been proven to be successful or unsuccessful, but they are widely used. And there are over 20 HIV medications on the market today. Some specific drug therapies include Icentris. This is an HIV therapy known as an integrase inhibitor. It must be taken with other HIV medications, and it enhances the quality of those HIV medications that are being taken along with it. However, this one by itself will not cure HIV or AIDS. Atriptyline is a nucleose reverse transcriptase inhibitor. This one as well does not cure HIV or AIDS, but it slows down the progress of the virus. It helps keep HIV from reproducing and appears to slow down the destruction of the immune system. But it will not prevent you from spreading it to other people, so you still need to use protection and be careful with how you come into sexual contact with other people. The third one is Raytaz plus Truvada. Raytaz is an HIV medication given to people that are trying a medication for the first time. This is normally the one that they start with. And Truvada is a combination of 2 medications that are in one pill, so that's 3 medications all in one, and it helps to lessen the side effects of it. And dolutegravir is an integrase inhibitor-based regimen. This blocks HIV replication by preventing the viral DNA from infecting the genetic material of the immune cells. I believe medication should be prevalent over education, because if these drugs are provided to those countries with high HIV rates, it could increase the life expectancy and dramatically cut how much the virus is spread in those countries. It can also improve the lives of those that are already infected with this virus, and with enough funding, maybe a drug could eventually be created that could stop the spread of the virus or reverse it and help somebody to not produce AIDS. And these are our sources.
Does anybody have any questions for Andy or Veronica? Thank you very much again. Oh, then we